Hi, everyone, and welcome back to Take the Weight Out of Weight Loss. We're back again for another episode, and I'm truly, truly excited for who we have on today. I have been fangirling her since I have met her, and the moment I met her, I said, "Oh my God, she's going to throw out so many nuggets of information for you guys." So I'm so happy to welcome and introduce clinical dietitian Tina Chagoury, breast cancer survivor, and so much more. She's an advocate for menopause. She's an advocate for anti-inflammatory diets, and I just can't wait to get into this conversation with her. Welcome, Tina.
Thank you. I'm more excited actually.
Yeah, like I said, I was truly fangirling you from the moment you spoke. Why I love what you talk about so much is you talk about topics that affect us on a daily level, and people don't emphasize on that. We're looking for quick fixes, we're looking for this, but no one, you're the first person when I sat there, I know we were at a breast cancer event, which I want to talk to you about that as well. But you spoke about anti-inflammatory diets and why that's so important. And in this day and age, people's like, oh, anti-inflammatory, I can take a pill for that. And so I love that. But before I go into anything and start picking your brain, please, if you can tell us a little bit about yourself and your journey.
Okay, so my name is Tina Chagoury. I'm a clinical dietitian. I've been practicing in the UAE for 20 years now. So I've seen thousands of women. But my practice was never focused on women before 2019 until I was diagnosed with breast cancer. And I had to go through the whole journey of a diagnosis, treatment, surgeries like chemotherapy, radiotherapy, surgery, and then the post-treatment, which no one talks about, the induced menopause. I was just 39 and I had to go through the hot flashes, the weight gain, being a dietitian. I've put like 17 kilos, anxiety, joint pain, name it. I mean, it's 57 symptoms and I felt every one of them. So while going through this, it happened also that my post-treatment started on day one of the lockdown in COVID. I remember going to the radiotherapy, my last session, the road was empty because I had a permit to drive. So just to put things in perspective. So I come back from that session and then the doctors would tell me, now you need to rest. And I'm like, music to my ears, lockdown, kids at school, kids at home, no activities, no social gatherings because I had no hair, no lashes, no eyebrows, 17 kilos more. The last thing I wanted to do is socialize or see clients in the clinic because the burden on a dietitian or on any health expert of sitting with a client to recommend weight loss and improve your life when I'm struggling deep down was unbearable. So anyways, I come back home and what do? I start my research and I start studying for a degree in functional hormone, to become functional hormone specialist. So I already have a BS in nutrition and dietetics. I already did my 12 months training in clinical nutrition in a hospital. I already have a master's in public health. I specialized in health behavior education. And all of this was not enough for me to understand why did I get breast cancer? One, what's happening to me? Two, how do I get over this treatment plan? And what is menopause? Why am I feeling what I'm feeling? Why did nobody tell me about it? How come in nutrition, 3 years of BS, 2 years of master's, 1 year of internship, that's 6 years, maybe we did, maybe an hour altogether about perimenopause and menopause and how to deal with men. So I'm like, this is it. This is what I'm going to do. And I put all my focus on hormones, perimenopause, menopause, and I started limiting my clients to women of this age group. I still see men, I still see younger women, I still see children, but it's not the focus of my practice. And so, so this is me now. I advocate for early detection, prevention, anti-inflammatory diet, which we will talk about, because it changed my life. It's as simple as this.
It's it's when I heard you talk, and as I'm hearing you speak right now, you're absolutely right. It's like this category of women just got forgotten about. It's like menopause; they'll deal with it.
Exactly.
You'll get over it. It's
And
hot flashes.
there's nothing to do about it.
Absolutely, absolutely. And so I'm so glad. And it reminds me of something my mom used to tell me when I was really young. And mothers are always right, right? She's like, Natasha, lose all your weight early because when you grow older, it's going to get hard. And I'm starting to see it now. The way I lose weight, the way my body responds to things now is much slower than when I was then. So if you can go through that dynamic with us, what really happens to a woman's body as we mature, getting into perimenopause, what's really happening there for a woman?
That would take like 3 episodes. But to put it in simple terms, so the elixir of youth in our body is estrogen. This is the elixir for the skin, for the glow, for the hair, for the joints, for the libido, everything. That's estrogen and progesterone. Now, as we enter our 40s, gradually for the next 10 to 15 years, this estrogen starts declining. Progesterone starts declining. And not only declining like you see it on the graph, no. Its function changes, it weakens. The effect that it has on certain things, because estrogen is an anti-inflammatory hormone. So as it declines, inflammation increases. And when you're 40, the last thing you will think, oh, maybe my symptoms is perimenopause. You know why? Because you don't want to think that you are going through menopause or you will get menopause. It's like we live in denial. And menopause when we're younger used to feel like in the 60s. And when you're 70, you're menopausal, right? Like when you're old, you don't need your body anymore when you're menopausal. Well, we're seeing lots and lots of women experiencing menopause at an earlier age and starting perimenopause at an earlier age, let alone women like me who undergo treatment for female cancers. So that's induced menopause at 30. We have women in the early 30s going through menopause. So this shift in hormonal balance, and I always say there is no hormones in our body cannot be discussed in isolation. I cannot mention estrogen without mentioning progesterone, without mentioning testosterone, without mentioning thyroid hormones, without mentioning adrenal cortisol hormones, without mentioning insulin. Everything is interconnected. If you go now on Google and you just type in hormonal pathways, you get like a graph with more than 100 interconnected hormones in our body, which means if estrogen is changing, everything else is changing. So your insulin is changing. You become more insulin resistant. Your ghrelin and leptin, which are your satiety and your appetite hormone, change. You will have more cravings. You will have less satiety. Even if you considering you're maintaining the same diet, the same lifestyle, because this is what I get. Women come to me at 45. I eat the same thing. I actually eat less. I exercise more. And I'm not losing weight or I'm gaining weight. And we will get to this. So yes, the metabolism decreases because, again, our ability to build muscles decrease. And our muscle mass decreases. And this puts us at higher risk of reduced bone density and osteopenia and osteoporosis. The absorption of nutrients in our guts decreases because inflammation increases. And so you start experiencing things like, all of a sudden I feel bloated after every meal. Or I did my intolerance test 10 years ago. I wasn't intolerant to anything. How come now I'm intolerant to half of the list, right? And this is where I tell them, it's not the food, it's you. So it's not the food, it's you. You are inflamed because you're going through these changes and you're not doing anything about it. So all those changes, we cannot reverse aging. We cannot reverse menopause. We can slow it down and we can ease our transition inside. And this is why starting very early on, not even in the 30s, I would say teenage girls need to be aware of the changes that will happen in their bodies and be ready. And this is where sugar consumption comes in. This is where endocrine disruptors come in. This is where stress, lack of sleep. Everything you do in your early years as a woman, you will pay the price when you enter menopause. Why? Because as you enter the menopause era, everything you had before exacerbates. So if you don't handle it before, understand what's happening before, have steps to change or to improve, yes, you will get to a point in your menopause or slightly before your menopause where you're stuck because you don't know where to start from.
Yeah. And I see this so often, I see it. And you're so right. It comes down to diet because I remember, so I am lactose intolerant. I think so, right? But it was much higher before when I was eating ultra processed foods. Now, I can have yogurt, Greek yogurt, not break out, and my stomach's fine. But if you look at the processed foods in my house, very, very minimal. And all of a sudden, I can tolerate lactose. So I'm with you 100%. And you mentioned something which I really want to touch on is, you said the education starts so young, right? It needs to start when they're in their teens. And are you noticing a shift there as well, as far as young girls when they get their period and things of that sort?
Ah, you mean the shift at teenage years? Of course, of course. Listen, if you look at the graph of the hormonal cycle in women, so from puberty to menopause, the cycle starts off, the hormones are low in childhood, and then come pre-puberty, 8, 9, they start going up like this, but they go up like in very uneven curve, right? You go up, and this is where we call the fertility years, and they're stable unless you have a hormonal problem, endometriosis, PCOS, thyroid issues, they're more or less stable. And then when you're entering perimenopause, the decline is exactly like the decrease is exactly like the increase that you feel in puberty. So, meaning the changes in the body, the changes in the mood, the changes in the guts, the changes in the perception, the way you see your body, your self-confidence is equally affected when you're a teenager, when you're going through puberty and you're going through menopause. What's the difference? When you're going through menopause, we expect you to be more mature, have enough life experience and enough knowledge to minimize the impact. When you're going through teenagehood or adolescence and puberty, chances are you have so much on your plate. You're switching from the child brain into the adult brain. You're confused, you're lost. You don't have enough cognitive capacity yet to make decisions, right? But the vulnerability is the same, puberty and menopause.
Yeah, absolutely. I mean, that's what I was assuming. I said, if it's happening on one end of the scale, it must be happening on the other end of the scale. I want to get into that actual weight gain aspect because I'm speaking to a woman, you're speaking to a woman, and they're frustrated. They're blaming themselves, right? In my case, when it comes to emotional eating, they're like, that's it, I can't control myself. I can't. I just want to eat and eat and eat. And so what is your take on all of that? I know there's emotional elements. I know there's the cortisol elements, the stress elements. But if you have a woman that comes to you and she's purely frustrated. Diet culture tells you you're a failure. You can't follow a diet and lose weight and keep it off. And she's fighting against all of this and her body is resisting it. Where does someone of that nature even start?
I mean, this is, I would say 90% of women who visit us in clinic or who visit us, they are going through this. This is one of the most common complaints. I think always the best way to start is at the very beginning. So let's talk about your childhood and your relationship with food. And I'm not a psychologist or a psychotherapist. I am trained in health behavior education. I'm trained in counseling and coaching, but so I don't go really into depth. And if I see that they need help in that area, I will definitely refer them. But why is this important? Because I really need to understand, why is she struggling with weight? We don't all struggle with weight for the same reasons, right? Some of us have hormonal issues. Some of us have psychological issues. Some of us were just raised to eat junk. Some of us have intolerance issues. Some of us have thyroid issues, medical issues. So we need to understand, where did it all start? And believe me, so many times during this conversation, they alone discover and they have this aha moment of, that's right. I didn't do the link between this and that. Contraceptive pills, fertility issues, stress issues, toxic relationships, everything has to do. And when we can pinpoint at least how it all started, or where did you go off track at some point? Because she would tell me, I had a normal body weight growing up as a teenager. We had a healthy eating habits in the family. And then I don't know, I was 19 or 21, and then I started gaining weight, and then I can't really think. And then I'm like, okay, you just finished university. Did you move cities? Did you move countries? Did you start a new job? And then she'd be like, yeah, I went for like 3 years to do my master's. And and when we know how it all started, we can know what's the problem. Okay? So, and when we know what's the problem, one, we can know whether we need to direct her into more testing, whether we need to understand a bit more on her hormonal health, whether we need to understand more on her relationship with food. And once we have this, this data in front of us, whether it's blood test, whether it's psychological assessment, whether it's whatever it is, and we lay it down on the table, then it becomes like obvious. Then she will find the solution on her own. And then this is where also sometimes frustration comes. Like, okay, we know that she gained weight because of a hormonal problem, okay? Let's take thyroid issues. And so she will tell you, yes, I want, not thyroid because it's a bit more specific. Let's talk about PCOS because it's there and it's common. And it's underdiagnosed or misdiagnosed or undertreated or mistreated most of the time. So she was diagnosed with PCOS at 13. Now she's 45, huh? She was given metformin or the diabetic medication for a few months, and she was told to eat healthy. You know, the traditional way, like take this pill and just eat healthy, like just stay away from carbs, eat this, eat that, and you should be fine, Okay, she was not given guidance enough. She did not know about what is PCOS. PCOS is an inflammatory condition, and inflammation is at the core of PCOS. And insulin resistance is the thing that you need to tackle when people present with insulin resistance, even if she's 13. Ma, look what she's eating. Is she sleeping? Is she over-exercising? Is she under-exercising? We don't just throw pills like this because it's, this is what the literature says. No, every person is different. With some women, with some girls, yes, we have to get to that route. But with others, we don't even need it. We need to educate our girls, our daughters, our clients to ask the right questions and wait for the answers. And if they're not happy with the answers, ask again, change provider, go for a second opinion. It's not because this person or this provider has a diploma hanging on the wall behind him that he knows your body more than you or she. No, not even me. You have to be convinced. And when you have a gut feeling, like let's say she's done all her research and she's done all the questions and she listened to the answers and she's still not convinced. She feels something is different off. She feels there is more to it than there is more to it.
Yeah.
And
Absolutely.
Trust your guts.
Absolutely, I agree. And you see people getting misdiagnosed left, right, and center. I have to ask you this question because I heard something really shocking. I have a client and she went to a doctor currently going through menopause. And, she was, we were talking about pills and he said, you know what, just get on Ozempic, Mounjaro, your entire thing. It's your solution. Don't even argue. Don't even do anything. And she's like, yeah, but can I just explain to you how I'm feeling? And this was in the United States. And he was like, why do you need an explanation when I'm giving you this perfect solution, right? Which is so sad. It is so heartbreaking. And we know the craze that's happening right now. It's taking over. How is that fitting into all of this with the misinformation?
It's unfortunately, it just feeds on people's vulnerability. And I am not, mind you, I am not against GLP-1s. I am not, there are two schools. There's the school that tells you absolutely not, we don't have long-term research. We do have long-term research. And we do have, and now the research is just tripled and quadrupled on these things because people are taking them, because we're seeing short-term results, and now we can see long-term results. So I am not against, and I never, if someone is a good candidate and has done all the testing and has tried everything else, and we see that she or he will benefit from a short-term intake of these GLP-1 under supervision of the medical practitioner, of the doctor, of the dietitian, with changes in lifestyle, with counseling, with, yes. But again, I repeat, this is one tool. This is one tool in a whole box of toolkit, the whole kit of tools that they need to achieve a long-term sustainable change. Meaning, I would never, I mean, if she didn't get the chance to explain, or didn't do the testing, or didn't have someone who listened to her, and if there's an underlying condition of eating disorder or disordered eating, or a bad relationship with food that hasn't been handled properly, the biggest mistake we do is just throw her on Ozempic or Mounjaro, because yes, she will lose weight at the beginning, but then she's not going to be on them forever. She hasn't learned anything in the process, and she hasn't solved her issues. So when she stops them, yes, she will bounce back. So yes, we use them when it's really under strict supervision, and when there's a whole changing process during the process, during the treatment.
Is that something that's getting more recommended now for people going through menopause? It is.
Yes, there's a lot of research being done, and I don't want this to sound like a call, like take them. No, because there are many who don't need them, and there are many who shouldn't take them, and there are many who will not benefit from them, right? So those who need them and will benefit from them and don't have counterindications to take them are the minority, right? But there are women who will benefit. We're talking insulin resistance. We're talking predisposition to diabetes. We're talking, and here, this is a tricky note. So no, we never give them for people who suffer from eating disorders. But there's research now for people with disordered eating, emotional eaters and people with disordered eatings. There are studies linking the intake of GLP-1s with a reduction in food noise. And this is where it comes handy if you're going through a program with a professional, whether it's an emotional eating specialist or a dietitian or a doctor or a functional doctor. They're monitoring you. Yes, it does help with food noise, but again, under supervision and with pre and post testing and all of it.
Yeah, thank you so much for talking about that when it comes to eating disorders, because that's always been my primary concern. Being diagnosed with binge eating disorder, that was never we never had that option. This was never there. So I've had to fight really hard to be where I am today. And some days it's still a battle, but then I know people, that struggle with binge eating, and they're being provided Mounjaro, Ozempic, and you see the struggles, right? You see the depression tendencies. You see other emotions that are coming out now because food's not masking it, and they're not knowing how to handle it. So thank you so much, because I truly believe this is not being talked about. All the benefits are talked, and I'm with you 100%. I truly believe for people strictly struggling with obesity or menopause for that case, and are not able to move or not able to get to that point, then yes, get the aid that you need. And then maybe it moves things along. Because that's what I've noticed with some of the most successful people, is that they use it as an aid, and that's all that it is.
Exactly. Be smart in your use. Unless you're pre-diabetic and you want to switch medications and move into this treatment plan, because you can take them long term. But if you're not diabetic and you're just there for weight loss and insulin resistance management, be very smart about how you use it, and work with a provider that understands this.
Absolutely. Yeah. I want to get a little bit more into diet, right? Because I know that's the key to everything here. And I want to touch on both aspects. One, for women struggling with menopause, what does that diet actually look like for them?
Well, as a general rule, it's the anti-inflammatory diet, right? So they have to stay away from anything that triggers inflammation. To name a few: processed oils, highly processed gluten products, highly processed dairy, sugar, grain-fed meat, hormone and antibiotic injected meats and chicken, and this group of food, which for most people listening now, they will say, we know that. That's not enough. Yes, it's not enough, because this is a general, this is the umbrella. And under this comes the personalization. It depends on you. So, do you have high stress level, right? Are you over-exercising? We have to tune down a bit your exercise. We have to change the composition of your meal. We might have to change the timings of your meals. We might have to add, most of the time we're adding meals, we're adding food, because most of the time she is under eating, over exercising, not sleeping, and depriving herself of the pleasures of life. That's most of the time. And we have to bring back, we say in French, la joie de vivre. So the pleasure of living, we have to bring this back, because you can do everything by the book and be unhappy and nothing will work. So I really want women to understand that, one, there is a solution, there's a way, but it will not come in 2 weeks. It will not come in your 4-week, whatever, enrollment in whatever program, gym. It will not come from that diet you're going to download online. It's not coming from there. It's coming from an actual and true and genuine relationship with the provider that you're working with, where you're sharing everything, your vulnerabilities. What is it that's in your heart? Sharing everything, your story, your struggles, the deep truth about everything. Because you know what? When you're entering menopause, I think you're at a stage in your life where you just don't care. You just want to be happy. You just want to live a decent life. And if weight loss will bring you this happiness, yes, lose the weight. I'm not with, oh no, we shouldn't talk about weight loss. It should always be eat healthy. No, sometimes she wants to lose this weight. She wants to feel, maybe she used to be leaner and she wants to feel that again. And if it's possible, why not? As long as the method and the message are not disrupting her health, or not disrupting her relationship with food. So it's a very personal journey, and it takes time, to be very honest. Depending on where she is in her health journey, it might take few weeks if it's just a little bit of changes, and it might take years of learning and unlearning. The unlearning takes more time than the learning, by the way. So, and I'm sure you agree with me on the unlearning bit, because, so many women come to me and they tell me what to tell them. I promise. She would come to me and tell me, don't ask me to do this because I will not do it. Don't tell me not to eat this because I will eat it. And don't tell me, okay, so if you know everything, why you're coming to me? Because they're so traumatized with their diet history and their diet trauma, I would say, that they're just on the defense all the time. Even if she comes to a provider, sometimes she's referred to me by the functional doctor, so it's not her choice to come to me, and that I understand, and we sit and we talk, and if she's not convinced, then she doesn't have to continue. And sometimes she's torn between, let me go ask for professional advice, but let me give her the advice, and until she relaxes and she trusts the process, she will not change. She cannot change. So the mindset shift is the most important bit of the journey.
Yeah, I agree with the unlearning. When people come and they're like, oh, but I thought this would be 6 weeks and it would be 8 weeks. And I said, how many years have you been doing this? 10 years? 15 years?
A lifetime.
Exactly. And you want all of that to finish in 6 weeks? Absolutely not. So,
you know why? Sorry to interrupt.
No,
because
yes.
this is what they're sold online.
Exactly.
This is what they're exposed to. This is what the lies they listen to when an influencer comes online and tells them, I did this in 6 weeks, look at my 6 abs, and hey, let me give you this program. It will. No, that doesn't work this way. And if it works with you or with 5 others like you, it doesn't work for the whole community of women that trust you and that are so vulnerable that they are grabbing on to any piece of hope they see online.
Yeah,
this is a huge responsibility we have.
Yeah, it's sad. It's really, really sad. And, I struggle with the exact same when people come on and they're like, but like how many kilos will I lose in the first week?
Yeah.
And I tell them at that point, I said, maybe we're not a right fit for each other, because for me, that doesn't matter. If you're going to continue doing your old habits after 1 week, then there's no work done.
Nothing changes if nothing changes.
Absolutely.
Yeah.
On that note, and having these women come into you, knowing the way you work and what your approach is, I truly believe, by the way, you should be like the anti-inflammatory, of the UAE.
Yeah.
Like I'm like the expert, because if people only knew the importance of this, how it could change their life, given the fact that you have this knowledge with everything that's out there, what is the resistance ratio like, and how and when do they respond?
Listen, now there's a huge difference between now, what I see now, and I would say 10 years ago. Because now women who come to me really come to me for that. So they know what I do and they want to do this. most of the time, most of them. Now, before 10 years ago, the struggle, even if my practice was a bit different, there's a huge resistance. Once, because they see someone who might have the knowledge but don't have the experience, right? So I posted, or I'm posting a video soon, and I started with, this is an apology video for all the women I met when I was in my 20s, and I really didn't understand what they're going through, right? Even if now I'm in my 40s, I'm not in my late 50s, but the experience I had put me in this age group, if you want. So I do relate to women in their late 50s, early 50s, menopausal. So because I have this experience and this trauma in my life, and because I also have my professional, degrees and all of that combined, women relate a lot and women listen a lot, and they don't resist as much. And they're really very open to the conversation because they know I'm genuine, and they know the advice I'm giving them, I lived in them. I tried and tested them, most of the advice I gave, and I believe, and I truly don't want to. It's like you said, I should be the anti-inflammatory guru or whatever, but what I actually feel is that I feel such a deep connection with women in their weight and health struggles that it's difficult for me to limit the time I sit with them to just those 45 minutes or 1 hour. Sometimes I feel like, if only I can go with you home and just open your cupboards and tell you exactly what you need to do. So when it's coming from the heart, the resistance is really minimal.
Absolutely. And people can see through it.
Yeah.
Right? They
Yeah,
can see
yeah,
it
yeah,
in this
yeah, yeah.
in this market where it's so saturated. I feel like people can see it from miles away. And your personal journey, of course, plays such a huge role. What was the key moment for you where you felt, oh wow, this is actually working for me and I can be an advocate for this?
There are many key moments. For instance, I'll give you an example. After my radiotherapy, so after the treatment when I finished all the treatments, basically surgery, everything, I started having, I cut down on sugar completely, and I started having my celery juice in the morning, and I shifted my baking at home, my cooking at home, and I didn't do it for the weight, and I didn't do it for the, hey, let's try this. No, because I was reading so much research, and I remember I was reading those peer-reviewed research, like scientific journals, and I would take notes on the side, what I can actually apply in my everyday, like this supplement, this thing, this thing. And then before I know it, I felt so much better. I felt better than my pre-cancer self. So much better. My skin was so much better. I started losing weight, and I promise you, it was not the intention. Actually, I didn't want to lose weight because I didn't want to compromise my immunity in this those sensitive few months post-treatment, because it's very important to focus on immunity. And immunity was at the top of my list. I needed to be strong. I needed to keep my blood clear. I needed to stay cancer-free. I needed to have the energy back because I lost all my energy during chemotherapy. I needed my health back for my kids and my family. And when you shift this mindset of I want to lose weight to I want to be better, things happen because you don't have deadlines for yourself. So things started happening when I started applying the anti-inflammatory liver, when I reduced my gluten, when I reduced my dairy, when I upped my omega-3, when I started eating more fish, when I became more mindful of the variety of vegetables in my food. Growing up in Lebanon, our go-to salad is cucumber, lettuce, tomatoes. Maybe onion, maybe parsley, maybe baqli, but this was it, like maybe fattoush, maybe tabbouleh, but that was the extent of it. But we would eat cooked spinach, we would eat cooked okra, we would eat, this is staples, green beans with olive oil. Olive oil was the staple. And when you get out of your culture, and when you're an expat, and a busy expat, I had a full-time job, 2 kids, you shift back into the easiest things. You forget what you were brought up eating, and you start shifting into the more Western type of living. And this is a very important point. Most of the time, when I sit with women of different cultures, we have to discuss culturally, what did you used to eat? What you grew up eating, what kind of food? Vegetarian, vegan, meat, chicken, meatless food, and when you shift back into your origins and into your roots, and obviously preparing them in a more anti-inflammatory, although mind you, most of our ancestors' food, grandparents' foods, is anti-inflammatory.
Yeah.
Because they ate less processed food. They used mostly homemade, handmade olive oil and ghee and food. So they had less inflammation, and this is why they lived longer. Yes, there's, they would argue now that no, the life expectancy now is higher. Yes, we have higher life expectancy with much more illness and debilitating illness. So we lived till 90 with 5 cancers, yeah. But before, they used to age well, and even if the age expectancy was lower, health was better in general.
Absolutely. I mean, so I'm of Indian origin, and at home now, I will make lentils, sweet potatoes. This is what we were raised on, and I've gone back to that. My partner is German, and he was like, I enjoy it. And it's changed. He's lost 14 kilos in a year, and we've done nothing. Literally, we've just reduced the amount of processed food. So you're spot on when it comes to that. You said something, which I think people are gonna sugar, right? Yeah. Sugar, 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 sugar. We're surrounded by it daily. It's almost, there's this addiction to it, this need in it. And when I work with the emotional eating aspect of it, you can see the people that want and need to have it every day. You can see the people that have neutralized it in their life and they're okay not having it. But the more you have, the more you want. What is this whole phenomenon? What is your take on it?
Listen, if you had asked me this question 10 years ago, I would have given you this answer. Oh, eat it in moderation, it's okay. It's not. I'll tell you why. And I'm not, and listen till the end. So don't take this as a scoop. Okay, let me sit properly. So, sugar does not feed cancer cells, because this is what people think. Like, yeah, don't eat sugar, it goes straight into your cancer cells. Sugar feeds every cell, okay? And that's not the issue. The problem with sugar is inflammation. And how is sugar linked to inflammation? And mind you, when I say sugar, and I don't mean your occasional dessert, no. I mean people who have a frappuccino with sugar in the morning, a cookie in the mid-morning with another chai latte with sugar. They start off their meal with the bread basket, and then they finish it off with another dessert and with a sweet coffee. Afternoon, you have a little bit of fruit salad, and in the evening, you're finishing off with a bowl of ice cream. This is the sugar I'm talking about. Why is it linked to inflammation? Because studies have shown the more fluctuations, peaks and dips you have in your blood sugar, the higher you're inflamed, okay? And there are so many other explanations for this inflammation, which are very physiological, and I'm not going to go into details with them, right? So let's put it this way. The more peaks and dips you have, the higher your inflammation is. Inflammation is at the core of chronic disease, at the core of insulin resistance, at the core of aging, okay? Now, when we reduce our sugar intake and we learn how to time our sugar intake, and I said reduce first because I don't want people to mistakenly think, okay, so I can eat the sugar after the meal, it won't spike my blood sugar, so it's fine. No, it doesn't only work this way. Eat less, eat better quality sugar, and time your sugar so that you avoid the spikes, you avoid the inflammation, but also you're not feeding your insulin resistance. You're not feeding your need more and more and more, and your addiction to sugar. Okay, when your blood sugar is stable, and by stable, it's never a straight line. It's impossible unless you're fasting. You know, on fasting, yes, we have a straight line, and hence the benefits of fasting for aging and so on. We can talk about this later, but the more the wave is easygoing in your blood sugar, the less inflamed and the more appetite control you have. And appetite control is at the core of weight management, disease prevention. If your appetite is out of control, and I come and give you the most healthiest, most amazing anti-inflammatory diet, but your appetite is already out of control and you just want these sugar fixes throughout the day. Yes, you'll follow the plan or you'll follow the recommendations, but you want to have those fixes because I can't, I'm addicted. You can't, because you don't have control over what you're eating, over your appetite. So to wrap it up, I am against a daily constant intake of processed sugar. I am against you going to supermarket and buying products with high sugar. I am against giving children only sweets and sugar-containing foods. But I'm also against deprivation and forcing yourself not to do stuff. You have to do it by conviction. You have to do it because you tried it, you're convinced, you saw the change in your body, and now you do it because it helps you, because because it's the health you're looking for. It's not just because you want to cut down on calories and lose weight. Nothing to do with calories. So once you understand the dynamics, and the most important, once you find the alternatives, because I can't ask you to, stop sugar. No, I have to teach you how to do it how to bake in a healthier way. What are the alternatives to sugar? The natural sugars, which ones work with what? This works raw, this works baked, this works in cookies, this works in coffee. There are many different types and stuff that you need to understand. And once you're more in control of your appetite, you will ask for less and you will get less. But I cannot come and impose on you to eat less when you're asking for more. So the idea is to get you to a point where you yourself, your body is asking for less. And that is why you're eating less, not because there's a paper that's forcing you to eat less. So it's really like everything else. You have to understand, be convinced, try, see that it's working for you to actually change and have a sustainable change.
Absolutely. I love that. I love how you put that, because it's so true and you see it in people's life. For someone who is grabbing that croissant, every almond croissant at 4 p.m. every single day, what would be a quick alternative for them?
I always say PFF plus C. Protein, fat, fiber, followed by the carbs. You want that croissant? Great. Start with a protein source. People will think, yeah, because if I'm going to a bakery and I'm craving this croissant, you're telling me to go back, get my Greek yogurt and my nuts, and then get croissant? Yes. If you want to change, and if you're serious about change, and if your health is your priority, and you said you've been struggling, you tried everything, well, you know what? Try this. Try this. If it doesn't work, go back to your almond croissant. Start with a protein and a fiber and fat, healthy fat. This, what it does, one, it's nourishing you, it's helping you, it's reducing this craving physiologically, not just psychologically. I'm not asking you to shut down this craving. No, I'm just asking you to take a step back, right? And try this. And keep the croissant in front of you and have the first bite of your croissant. If you manage to finish the whole croissant just like you would have done it before this process, then you need more practice, or then this method doesn't work for you. But in 99.99% of the cases, you will have a bite. Maybe you'll have a bite and you'll be full and you'll be satisfied. You'll have had your croissant, but without the spike that will come after from the blood sugar and all the other ingredients in the croissant that might not be good for you.
Absolutely. Thank you. Thank you. Thank you so much. I mean, I feel like we need quite a few episodes to cover. A series, exactly, because we've touched on so much today. But it's just the cream of the cake, not even the in-depthness. If you can leave one message for women, because I know they're going to love what you've said, but if there's one message that you can leave for them that can be their turning point or something for them to think over, what would that be?
It's easy. It would be change your mindset, shift your mindset from weight to health. That's all it takes. Think health. And once your health is in order, once your inflammation has decreased, once your hormones are balanced, the weight will go off alone. And trust the process. And I'm not saying this because it worked with me only. I'm saying this because it worked with most, if not all, the women I work with. And it takes time. Just be patient, trust the process, and shift your mindset from weight to health.
I love that. Thank you so
Thank
much, Tina,
you.
for
Thank
joining
you
us
for
today.
having me.
And I know we'll be back
See
for
you
sure.
soon. Yes, yes. Thank you.